It took just 10 seconds. One quick mistake that no one noticed until it was too late. In mid-2025, a family of 4, all recently vaccinated and feeling secure, suddenly fell ill within days of each other. What happened inside their seemingly safe home would soon spark a national investigation and change medical protocols forever. It all started on a routine Tuesday. The Johnson family had just received their updated COVID-19 boosters at home, a convenient new service offered by their local clinic. Afterward, everything seemed normal. They experienced the usual mild soreness and a bit of fatigue, but nothing alarming. Life went on. They shared dinner, laughed, and settled in for the night. But later that evening, their youngest son, Leo, started complaining of dizziness. By the next morning, the entire family was battling high fevers, chills, and debilitating body aches. Confused and worried, they rushed to the hospital. At first, doctors were puzzled. The symptoms were far too severe for a typical vaccine reaction. It wasn't COVID. It wasn't the flu. So what was it? The breakthrough came when a sharp-eyed lab technician noticed something unusual in their blood samples. All 4 Johnsons tested positive for Listeria monocytogenes a dangerous foodborne bacterium. The infection didn't come from the vaccine itself. It came from what happened in their kitchen but before the shots were given. Investigators pieced together the timeline. The visiting nurse, juggling paperwork and supplies, had placed the sealed vaccine vials on the kitchen counter for just 10 seconds while she organized her forms. Unbeknownst to her, that same counter had been used to prepare raw vegetables earlier that morning and hadn't been properly sanitized. Those 10 seconds were all it took for microscopic bacteria to transfer from the countertop to the exterior of the vials. When she later drew the doses, a tiny, invisible droplet carried the contamination from the vial surface onto the needle and into the vaccine. One tiny oversight, a momentary lapse in protocol, had unleashed a bacterial infection inside for healthy people. Within hours of being admitted to the hospital, the family's condition worsened dramatically. They suffered from severe fever, unrelenting nausea, and agonizing muscle pain. The situation grew critical when young Leo was rushed to the intensive care unit, his small body struggling to fight the aggressive infection. The hospital's investigation quickly traced the listeria back to the home visit, leading to an urgent recall of the clinic's entire batch of vaccines for safety checks. The nurse was devastated. A simple 10-second mistake, an action she'd probably done 100 times without a second thought, had caused an entire family unbearable suffering and put a child's life in jeopardy. Thankfully, with intensive antibiotic treatment, the Johnson family pulled through. They all made a full recovery, but the incident left a permanent mark. Their harrowing experience became a crucial case study, sending shockwaves through the medical community. Because of what happened to them, new, stricter safety protocols were implemented worldwide for all mobile and in-home medical procedures. New rules now mandate the use of sterile disposable mats for all medical supplies and reinforced training on surface contamination. One family's terrifying ordeal became a global lesson. Health safety isn't just about the medicine itself, but about every single moment and every surface involved in its administration. One small action, 10 seconds, that's all it took to change a family's life and improve vaccine safety for millions. This story is a powerful reminder that in healthcare, there are no small details. If this story opened your eyes, imagine what else you don't know. Subscribe for more true stories about the hidden dangers and life-saving lessons that shape our world. Thanks for watching, and stay safe.